You're at the park, calling your dog's name over the noise of other pets in traffic. You see their ear twitch slightly toward your voice, but their body remains locked in place, staring at a squirrel. You call again, louder this time, but the dog doesn't even turn around. Most owners take this silence personally. We assume our dogs are being willfully defiant, which leads to a predictable cycle of escalating volume, frustration, and eventually punishment. To bridge this gap, we have to stop treating ignoring as a personality trait. In a clinical context, a dog failing to respond is a symptom of an underlying condition. Labeling a dog as stubborn makes us ignore the vital data they are actually providing. A lack of response offers a direct look into the dog's physical comfort, their sensory range, or intense environmental stress. Canine unresponsiveness is a failure of the communication loop. Solving it requires a systematic diagnosis of the barrier between the owner's command and the dog's reaction. Physical pain is the most common hidden barrier to obedience. When movement causes distress, a dog will often freeze in place, a self-preservation tactic that humans easily misidentify as a refusal to cooperate. Cervical hyperesthesia, or severe neck pain, makes the simple act of turning toward a voice or looking up at an owner physically punishing. For a dog in this state, responding to a command is something to be avoided. This biomechanical schematic shows how a dog's spine reacts to gravity and movement. The signs of this pain are subtle: a low head carriage, unprovoked vocalizations, or a sudden reluctance to walk down steps. Descending stairs is particularly difficult for them, as the downward angle heavily compresses the cervical vertebrae and activates acute pain pathways. To the duller, a dog that refuses to come off the couch or hesitates at the top of a staircase looks like they've lost interest in following directions. That perceived apathy is actually a logical defense against physical trauma. The dog is prioritizing their safety over the owner's request. Sensory degradation is the second major barrier. Dogs are so effective at adapting to their surroundings that they can mask a significant loss of hearing for months or even years. This decline can stem from genetic predispositions in certain breeds, or normal aging, or the long-term effects of chronic ear infections that damage the internal structures of the ear. Owners often miss the behavioral indicators of this loss, like startling when touched from behind, sleeping through loud household noises, or a sudden change in bark. This diagram compares two brainstem auditory evoked response, or BARE, test outputs. On the left, we see a healthy, spiked electrical brainwave response to a sound stimulus. On the right, a flat, unresponsive wave confirms literal neural deafness. The myth of selective hearing hides a physical deficit. When the dog fails to respond, it is often because the signal never reached the brain. Sometimes the body and senses are healthy, but the cognitive software fails. This is where the communication loop breaks down at the level of understanding. This flowchart shows a verbal command entering a dog's brain. If used repeatedly without consistent outcomes, the dog experiences learned irrelevance. Repeating this devalued command leads to cue saturation. The brain filters the word out entirely, processing the voice as meaningless background noise. In a high-stimulation environment, like a busy park, or during states of intense anxiety, the dog's cognitive bandwidth is completely occupied. They physically cannot process a devalued command, while their brain is prioritizing environmental threats or rewards. What we interpret as defiance is simply a weak cue drowned out by a high-value environment. Because unresponsiveness is a mechanical failure, the solution requires auditing our own output. Punishment does nothing to clarify a devalued signal. For dogs with sensory loss, we must transition to high-contrast visual hand signals. We can also use environmental cues, like tapping the floor to send a clear vibration the dog can feel. If the issue is behavioral, we have to retire the burned-out command. We start over with a brand new word in a quiet, low-distraction space to build its value from the ground up. This logic loop shows the life reward mechanism. Instead of using treats, the dog earns access to what they want in the environment, like going for a walk or eating dinner, only after providing a correct response. Compliance becomes the direct requirement for the reward. Shifting from frustration to clinical curiosity lets us move past the myth of the stubborn dog. Ultimately, it creates a lasting partnership built on clear communication and a genuine understanding of our animal's reality.